Dr. Kenneth Snow, acting chief of the Adult Diabetes Program at the Joslin Diabetes Center, clinically affiliated with Beth Israel Deaconess Medical Center, answers questions for those newly diagnosed with type 2 diabetes. First, am I going to be okay?
Our ability to control blood sugars has never been better. It's not that it's easy. They need to take medication. Folks need to monitor. It does require some work. But our ability to do it has never been better, and we're able to control blood sugars. We know how well folks will do is very much related to how well controlled the disease is, their blood sugar, their cholesterol, their blood pressure. And so if you catch somebody early on in the process, they've been getting good medical care, they've just been diagnosed, it's early on in the diabetes process, we have lots of good options to keep their blood sugars in line.
Will I need to take insulin shots?
Of course, they're going to be concerned, do I need to be on insulin? And the answer to that for somebody most recently diagnosed, if they have type 2 diabetes, the answer almost always is no. There are lots of oral agents, there are lots of pills, there are lots of options, diet therapy, nutrition, exercise. There are lots of things to do. If insulin's needed, insulin will be used, but frequently it's not.
How important is diet and exercise?
Diet and exercise are absolutely wonderful forms of therapy. We know that folks are too sedentary, they tend to be heavy when they get diagnosed, they're carrying extra weight, and by losing even a little bit of weight, increasing the amount of activity, this can have a dramatic effect in terms of blood sugar control and how well they're going to do with their diabetes. Having said that, we know diet and exercise therapy is a tough thing to do. It's fantastically successful. It works great, but it's tough to do. So absolutely we want to prescribe it. We want folks to do it. People should do it, but if they can't do it, or if they can't do it yet, they shouldn't use that as an excuse to blame themselves, but rather say, okay, I'm not able to do that right now, and I need other therapy to help control my blood sugar in the meantime.
Finally, will I be able to do the things I normally do?
Folks with diabetes, for the most part, are able to do almost anything. It just takes a little bit more planning. So, will they need to be looking at their meal plan a little closer than they were before they were diagnosed? Absolutely. Should they be trying to fit in that exercise every day? Sure they should. Will they need to be monitoring their blood sugars? Yes, they will. They'll need to know where their blood sugars are. If they're on medication, they'll need to be taking their medication. But from the point of view of will this impact on their work, will they be able to go to work, will they be able to enjoy their free time and go out? We have folks who participate in all forms of activities. Diabetes, while it can get in the way a little bit, it doesn't stop you from doing anything.